Tonight, a record 13 confirmed COVID-19 related deaths moves Jamaica's death toll from the virus to 507, with a record 821 new cases. Health and Wellness Minister promises that the ongoing audit of the COVID-19 vaccination program being rolled out in the public health system will account for all doses of vaccines used, as well as any that are lost.
So in relation to how much vaccines have been administered, the vial, the waste, it is important that we audit the program to determine where we need to improve.
Still tonight, Opposition leader Mark Golding says many of the individuals who applied under the government's CARE program in the early months of the COVID-19 pandemic last year are yet to receive a benefit.
Many people who qualified and applied for assistance under the CARE program are still waiting to receive it.
And gunmen fatally shot a security guard during a daring daylight robbery at the Public Sector Cooperative Credit Union at Caribbean Estate in Portmore, St. Catherine yesterday. Good evening. A record 13 newly confirmed COVID-19 related deaths have pushed Jamaica's virus-related death toll to 507. According to the Ministry of Health and Wellness, the island also recorded 821 new cases of the virus, taking the total of confirmed cases now to 32,728. 7 of the 13 deaths were recorded in Kingston and St. Andrew, including 5 women aged 46, 56, 73, 61, and 79, as well as 2 men aged 86 and 50 years. The other deaths were of 2 males aged 62 and 78 from St. Elizabeth, 2 women aged 81 and 59, and a 71-year-old male, all from St. Thomas, as well as a 26-year-old woman from St. Catherine. Now, of the 821 newly confirmed cases, the ministry noted that 477 were female and 344 were males, ranging in age from 1 day old to 95 years. The cases were recorded in Kingston and St. Andrew with 226 cases. St. Catherine recorded 195 cases. St. Thomas recorded 92 cases, Manchester 48, Clarendon 41, St. Mary and Portland recorded 39 cases each, St. Elizabeth and St. James 33 cases each, St. Anne 31 cases, Westmoreland 22, Hanover 16 and Trelawney 6 cases. The island also recorded 102 recoveries, taking the total of recoveries from the virus now to 15,473. In the meantime, Health and Wellness Minister Dr. Christopher Tufton has promised that the ongoing audit of the COVID-19 vaccination program being rolled out in the public health system will account for all doses of vaccines used, as well as any that are lost. Speaking yesterday at a joint select committee of Parliament examining the government's COVID-19 response, Dr. Tufton pointed out that the international benchmark for wastage is 5%.
We will close the week, I believe, well over 85%, perhaps even closer to 90%. I think that is an admirable achievement, given that this is the first week, and we expected that we would have a few issues, because this is how it is. It's a start of a process that is going to last the better part of a year, and therefore we have to learn in the early stages, but it will get better with time. So I want to commend the team, and I want to say to the public and to this committee, we are learning as we go along, and to the extent that there may have been some issues, we correct those issues. That part of the vaccine plan requires an audit, and that audit is in fact taking place as we speak. So in relation to how much vaccines have been administered, the vial, the waste, and that sort of thing, but just to say that it is already fixed in the plan for that audit to be ongoing, and not necessarily to determine deviant behavior, even though that may turn up, but to also improve the efficiency of the program. It is important that we audit the program to determine where we need to improve transaction time and cost, because ultimately that's what determines efficiency, managing transaction time and cost.
The Health and Wellness Minister has also reported that several staff members at the Western Regional Health Authority have been reassigned at the site where several doses of COVID-19 vaccines went missing on Monday. Now, an investigation has since been launched at the Cornwall Regional Hospital in Montego Bay, St. James, into the disappearance of the vial containing 10 doses of the COVID-19 vaccine. The Health and Wellness Minister said the investigation includes the review of CCTV footage and the policies and procedures at the site. Meanwhile, the Health and Wellness Ministry says it is now reviewing reports that 6 doses of the AstraZeneca vaccines were accidentally damaged at the Lucy Health Center in Hanover. The incident reportedly occurred when a vial fell from the hand of a worker who was returning it to a cold storage container. The ministry further stated it is also checking on reports that 8 doses of the vaccine broke after falling from a cold storage container that was on a table that collapsed. Now we understand that the incident occurred at a site in Westmoreland. The ministry undertakes periodic audits of personnel, process flow, and usage of vaccines, and promises to make public the outcome of its investigations. As we continue with the latest news, on March 22, the government will launch its web-based system for the registration and scheduling of appointments for persons who wish to receive coronavirus COVID-19 vaccines. Now, this announcement was made by Permanent Secretary in the Ministry of Health and Wellness, Dunstan Bryan, during the sitting of the Joint Select Committee on the COVID-19 pandemic and related matters held yesterday.
So the appointment system will begin with persons. So there will be a public announcement of the appointment system and its launch. And persons will be able to call in. Persons will be able to be registered by the parish health department. Persons will be able to register using a website, or persons can engage their private practitioner, their private doctors, to make appointments for them. Once they have engaged the system, they will be prioritized. And the prioritization, as I pointed out, is on the phase basis. So if you are not in that phase, the system will not give you an opportunity to make an appointment. If you are not in the prioritized group, meaning if you are not 75 and above, at this point in time for the first couple of weeks, you will not be given an opportunity to make an appointment. And as we move through the different prioritization schedules, you will not be able to. You'll be able to make the appointment at the time. Once you are prioritized and you have received their notification of prioritization, the system will send you a message either by text or email, or you'll be called by the call center that we are engaging. So if you do not have a cell phone, but you have made an appointment, or you have, if you indicate when you are making the registration that you do not have a number, a method of reaching out to you will be established either through our community health aid, our parish office, or we will have our mechanism with the call center to make a call to you.
It was noted that during the week of March 22 to 28, elderly persons 75 years and older and parish council representatives who are 60 years and older will be able to take their vaccine.
Monday, the 22nd, we will launch our web portal for the scheduling and appointment and registration of persons for vaccines. And once we start that process on Monday, the week of Monday the 22nd and 28th, we will be vaccinating our parish council persons 60 years and above. And we will begin our elderly 75 and above. So persons who are 75 years and above will be required to engage the software. They will be also able, and I'll walk through that process. The week of March 29 to April 4, we continue with the elderly 75 and above. And then we move from there into the wider elderly group, 60 years and above, depending on the supply of vaccines in the week of April 5 to 11.
Still making the news tonight. Opposition leader Mark Golding is contending that many of the individuals who applied under the government's CARE program in the early months of the COVID-19 pandemic last year are yet to receive a benefit. Now, Mr. Golding, who was making his contribution to the 2021 to 2022 budget debate in the House of Representatives yesterday, criticized the level of assistance offered by the government.
The CARE program launched last year was the government's primary response to this socio-economic crisis. However, it provided less than 1% of GDP of direct assistance to vulnerable Jamaicans and businesses. Past beneficiaries received 1 month's extra benefit. The pre-COVID unemployed received a single payment of $10,000, and that was over 8 months ago. As regards businesses, the government chose to make formalization a condition of accessing assistance. This approach effectively ensured that many micro and small business owners were unable to access any assistance under the CARE program. This outcome was entirely predictable, given the high level of informality in the Jamaican economy.
Mr. Golding also stated that beneficiaries under the Program for Advancement through Health and Education, PATH, only received 1 month's extra benefits.
What is more, Madam Speaker, many people who qualified and applied for assistance under the CARE program are still waiting to receive it. In the tourism sector, there are hotel workers and craft vendors who have not been paid the assistance for which they applied. Similarly, small hotels have been unable to access the financing that they were told was to be provided for them by the Exim Bank. The transport sector has the same story. Last year, owners and operators of public passenger vehicles were promised $25,000 or $40,000, depending on their category. They applied for this, many of them from June last year. To date, however, not a cent has been paid out to many of these taxi and bus operators. They are suffering great economic distress. The pandemic has reduced travel due to school closures, working from home, and the curfew.
Meanwhile, the opposition leader during this morning's PNP conference explained that an alternative national budget, which would comprise an additional expenditure of $21.5 billion that the PNP has put forward, will be of benefit to Jamaicans if it's spent the way they propose the government should.
We're in a low interest rate environment, very historically, internationally, and locally as well. The borrowing capacity of the government is therefore, its ability to service loans is improving as a result of interest rates being low right around the world and in Jamaica. So 1% additional debt in the GDP, debt to GDP ratio is not a huge risk. We are coming from a place where we were at 147% of GDP. We have brought it down, last government brought it down to about 115%. It went further down since then to 94 now because of the shrinking of the economy, not the borrowing of money, but the shrinking of the economy. It is now roughly 110%. If we had to borrow to fund an additional 1% of GDP and spent it in the way that we have identified, with investing in the people, helping businesses, and also building out the tech infrastructure so that we can modernize the economy and in the post-pandemic world, it will generate more rapid recovery, more revenues to the government, and the ability to service the borrowings better.
Mr. Golding also explained that $17.9 billion of the more than $33 billion dividend the Bank of Jamaica, BOJ, earned between 2018 and 2020, which the bank will be remitting to the Jamaican government, is effectively a tax, the brunt of which is paid by poor Jamaicans.
The government is funding this budget in part by a dividend from the Bank of Jamaica, $33 billion dividend. When you analyze the financial statements of the Bank of Jamaica, over half of that dividend comes from foreign exchange trading gains and from unrealized foreign exchange gains on the foreign currency assets that the Bank of Jamaica holds, which greatly exceed its Jamaican dollar assets and greatly exceed its foreign currency liabilities. So the reason why that has generated those profits is because of the devaluation of the currency and the volatility of the currency over the 3 years in which the $33 billion was generated. I simply made that point because I think the Minister of Finance was, first of all, a bit disingenuous by only referring to the realized gains and not the unrealized gains, which were actually more substantial. And secondly, because the effect of the devaluation, which has generated those profits for the Bank of Jamaica, is the additional hardship on the backs of the Jamaican people. Those price increases that were reflected in that board that the Shadow Minister of Finance held up in his presentation are real, and they greatly exceed inflation because many of those items are imported, and as a result, they have brought significant hardship on the people because those are the items that the people of Jamaica largely consume to live. So my point was that devaluation is a tax on the purchasing power of ordinary Jamaicans whose income is largely in Jamaican dollars. And so to crow that it is good policy that has generated those profits to pay that dividend, I think it's a bit heartless and has not focused attention on the reality of how those profits were generated.
Now, opposition spokesperson on education and training, Angela Brown-Burke, on her part, says she supports an extension to the current school year, but the Ministry of Education cannot make the decision unilaterally.
I believe that there are a number of teachers and students and educators who have been really creative, innovative, and that they have found ways to cope. And I believe that we are going to need to have a conversation with them in terms of charting the way forward. But what is clear, for example, early childhood education can be done online. You know, our preschoolers need to develop those social skills, and they're really done through play. They're not done anywhere else. There are individuals, as implied in the question, without devices, without consistent connectivity. But also don't forget, there are students who don't have a place that they can set up, even if they have the device, that they can go online and do online learning. There are teachers who don't have a space that they feel comfortable putting on show for the online teaching learning process. So I think that when we are talking about what we're doing, we have to remember those realities. The truth is, for years we have been talking about really making sure that all our children are learning. I think it is about time we did something that showed that we really mean what we say.
Responding to questions, Brown-Burke said that schools have experienced learning loss, but it has not been across the board in the same way.
I believe that face-to-face is, based on the data that we're looking at, the most effective means of engaging our students. Now, in the world that we're facing, there is no doubt that in the future we're going to have some kind of a hybrid system, blended system that also includes some form of virtual and so on. What we have to remember about Jamaica and the education system that we have, and the leader of the opposition spoke to that, is really to remember the level of inequity and equalness that exists in the system. And so what we have to make sure is that those who were limping along before COVID, because we have lost a year, but there are so many students that have lost more than a year because they came into September, some a year behind, some even more than that behind. They lost a year, which means that they are now 2-3 years behind, just simply in terms of time and the teaching learning process that they would have lost. What we cannot tell, and we need to do the necessary research, and it's one of the questions I have asked the Minister of Education. How are they monitoring the full engagement of students, not just someone who has logged in, but someone who is actually fully and effectively engaged? What are they learning from the research and the data that they're gathering, and how they're going to use that to determine how we go forward?
Stay tuned for the full press conference following this newscast. Still making Mello TV news, students who are sitting the CSEC and CAPE examinations have been given free access to online support portal 1X platform. It provides a range of more than 40,000 examination questions, solutions, and video courses with full and partial coverage of the syllabuses that are immediately available to students with accompanying quizzes to assist their understanding of the subject areas. The Ministry of Education has announced that this move is part of its efforts to give grades 11, 12, and 13 students full support in the exams. Now, currently, students can only access 8 subject areas in CSEC. However, the new platform will allow full syllabus coverage for all subjects in the next 2 months and will continue until June 30. Now, there is also gamification for students to gain points, badges, and certificates for encouragement and friendly competition with their peers. In other news tonight, gunmen fatally shot a security guard during a daring daylight robbery at the public sector cooperative credit union at Caribbean Estate in Portmore, St. Catherine yesterday. Now, the deceased security guard is reportedly employed to the Hawkeye Security Company. Another security guard, who is also employed by the Hawkeye Security Company, has been hospitalized with a bullet wound to his right leg. The Corporate Communications Unit, CCU, the information arm of the Jamaica Constabulary Force, confirmed the robbery but could not disclose whether the robbers absconded with cash. A large contingent of soldiers and police personnel have been scouring the area in search of the armed perpetrators who fled the scene of the robbery in a Nissan motor car. The vehicle reportedly crashed at the intersection of Salt Pond Road and the Spanish Town bypass. Meanwhile, Crime Stop Jamaica is asking the public to assist the police in their investigations into the brutal attack at the public sector cooperative credit union in St. Catherine yesterday, which resulted in the death of the Hawkeye security guard and the injuring of another. Those persons with information on the whereabouts of the suspects are being asked to call 311 or visit crimestop.org or 311tips.com and say what they know. And those are some of the stories making news. We will return with other stories as victims of crime are being encouraged to contact the Victim Services Division, VSD, of the Ministry of Justice to access counseling support. And the Electoral Commission of Jamaica, ECJ, is reporting that the deadline to register for the next voters list is Wednesday, March 31. But first, we'll go to a break, and then it's over to Christopher Scott with the very latest in sports.